Welcome to Gracefully Graying. I am your host, Attorney Henry Gornbein. Today on Gracefully Graying, I am very pleased to welcome Joanne Giardini-Russell as she leads us in a discussion of what to expect next with Medicare. Joanne, welcome to Gracefully Graying.
Well, thank you, Henry. Thanks for having me on here. This is great.
First of all, why don't you tell our viewers a little bit about your background and your role in this very complicated area of it's almost like alphabet soup every year, trying to figure out what's the best plan, where do you go once you reach a certain age.
No doubt. So it's funny that you say the word best. So we never can and don't use the word best. And there's a whole bunch of reasons why, of course. But we've been doing Medicare for 10 years, for a full decade now. And we have an agency. It's based in Michigan, but we're virtual. So just like this podcast is virtual, this is how we operate with our clients. Not so much this screen, but we do telephone calls, kind of old-fashioned, just speakerphone. But we work in 22 different states. And all we do as a team is help people, number one, figure out if they need Medicare, because everybody assumes you need it when you don't always need it at 65 years old. In fact, Henry, you started, I think, pretty late to Medicare from what I recall, and because you were working, right? So when people are working, they don't need to. So that's a whole different conversation. But it's basically getting people to the point where they understand if they do or do not need Medicare. And if they do, then we get them there in the right way. We give them their choices. Do you want a Medicare supplement or do you want a Medicare Advantage plan, and talk through all of those things. We'll touch on this, I know, in our conversation, but about just the noise and the chaos that is in Medicare, it makes it challenging for the consumer. So we've built our business basically starting with, what they need and then giving them what they need or what they want, and basically focusing on education, which is why I love to do, sessions like this, because it really does help the educational component of Medicare.
Joanne, what is a Medigap?
Medigap is another word for a Medicare supplement, and people need to be careful because a lot of people that have what we call Medicare Advantage, that is an HMO or a PPO arrangement with an insurance company. If they have an HMO or PPO, a lot of people will say, well, I have a supplement, or they think they have Medigap. They do not. So a Medigap plan is something that somebody would buy, and you would buy it in addition to having your original Medicare with the government, Part A and Part B. You'd have those two pieces in place. And then you would buy this thing called a supplement or Medigap. We like to call it Medigap because it sounds a little more different, but it's basically following original Medicare. So if you have original Medicare, they're going to pay their 80%, and your Medigap contract is going to pay the rest in most cases. So you're buying this little policy with an insurance company that all it is there for is to pay your bills. That's it. It does not have any impact on your world. You don't call the doctor and say, hey, do you take United Healthcare? Do you take Blue Cross? Do you take Aetna? That kind of thing. So it's a little different. It's a contractual item. It's a policy. It's got policy language that's contractual and standardized, which is actually very good for the consumer. But it has a price tag. So the thing that consumers don't like about it at times is that it has a price associated with it. You pay a flat fee every single month, whether healthy or not healthy, whether you're using it or not. You're going to pay that price tag every month, and those prices do go up. So people don't like that feature. However, it is hands down the best insurance you can buy for your body medically.
I mean, I've noticed I saw a price increase on some of my policies, I think in June. So yes. They keep going.
Yep, they go up at different times of the year. Some are June, some are April, some are October. But yes, absolutely. They do go up. And we try and get that message out that they will go up. Just expect that. They're fabulous insurance, but they will go up in price.
Now, I know that every fall, I think starting with October or November, you have to pick your plans for the subsequent year, correct?
A little bit. So people with a Medicare supplement, a Medigap, like yourself, all you have to worry about is drug plans in the fall. So people, if for some reason somebody wanted to change their Medigap plan, that little policy, it's just like your car insurance. You can change it at any time of the year that you want to do that. Drug plans are very key for the fall, from October 15th to December 7th. Medicare Advantage plans are another one that are very dependent on the fall. Those are the times you can only do certain things with those two plans. But so many people presume that you can't do anything with your Medigap, or that you can just change it and do whatever you want in the fall. those are mythical statements. Okay, so drug plans and Medicare Advantage are relegated to the fall.
Joanne, what will happen to prices in the coming months? You said they're going to go up. They're going to keep going up. And do you think there are going to be sharper prices with everything that's going on in our economy?
Yeah, you know what? And it follows just along that statement. It really has come down to healthcare is just exploding with everything. I've seen quotes for individual insurance, ACA marketplace coverages, which we don't do those, but I've seen, reading material about, 15 to 18% increases for sure. Insurance at workplaces are all increasing. Everything with healthcare is just exploding. And it has been for the past 2 years. So the Medicare supplement market, they're just going to keep going up. So we're telling people we used to be able to say, hey, this is going to go up 5 to 7%. That was 4 years ago. Now we have to say really 10 to 15. Just prepare yourself for 10 to 15%. It just goes up. Drug plans are going up in some ways because of a cap on prescription medications. So that's a little different. But in terms of just Medicare supplements, we've got different rules in different states. In Texas, there's just a new bill that's starting September 1st that is allowing every single person with ALS and end-stage renal disease to get these plans, just like everybody else. And because they're guaranteeing access to those plans, we're seeing some of the Texas plans just sort of explode too. So there's a lot of different reasons that they go up. And it has to do with access, inflation for sure. But our basic message is just don't look for that perfect plan. Be careful in what you're buying, but don't get obsessed with finding perfection because you just cannot find it in this market. You just can't. And it's difficult to change if you don't get perfection. So just kind of prepare yourself for that.
Joanne, what will happen or what will be the impact of the new $2,000 cap on out-of-pocket costs from the big, beautiful legislation that was recently passed?
Actually, the $2,000 cap was actually from the Inflation Reduction Act years ago. So that's playing out that. So this was your first year where the $2,000 cap was an impact. And for some people, it was fabulous because we had people truly paying $5,000, $6,000, $7,000, $8,000 out of their pocket that now paid $2,000. So that was a positive thing. Now there's cost shifting, right? Because they're just not going to give all this free coverage away. They're not going. The insurance companies are just not going to roll over and pay all the money. So it's going to be coming from other consumers. So there's definitely cost shifting. So we've seen some plans that might have been $20 last year went to $60. It just depends. So that's why some of it's good, some of it's not so great. You have to really, really pay attention to your annual notice of change because every single year those drug plans, they change. They can change. They will change. The insurance company will change them. In September, they give everybody a heads up. A piece of paper comes in your mailbox and he says, here's what's going to change with your plan. And you need to pay attention to those documents because if you're in a plan that's really going to shift, don't forget you have your ability to get out of that plan potentially in the fall. So you got to pay attention. But I think it's really most important for every consumer nowadays to just really start paying attention to this stuff because of the cost on all these different sides going up. It's a thing. It's like coupons at the grocery store, right? It's just, it's kind of hitting us from all angles and it's frustrating for many people.
And there are so many choices. How does one shop for plans each fall if someone is in the market or wants to change? I mean, this is your job, I know, but I get this booklet every year in the fall, and there are just dozens and dozens of choices and pages. And
Yes.
For any layperson, it's confusing.
It's very confusing. It's very challenging. This year is going to be a more challenging year. I did a TikTok yesterday. So every day I'm on TikTok talking about Medicare. Yesterday, my topic was that this year is going to be an exceptionally challenging year because number one, there's so many plans. There could be 70 plan offerings in Oakland County, for example, for Medicare Advantage. So when you're looking at that, where do you start, right? So you might know there's 70 plans available. Well, what's happening now is some insurance companies are coming in to the agents and telling us that if you put somebody in this PPO plan in Oakland County, you're not going to be compensated for that. So you're going to have some agents that are just only going to show people out of 70 plans they might have available to them. Maybe they're only going to show 30. So all of a sudden, the consumer is not going to be seeing everything that they're eligible for potentially. So how we're going to handle that is basically say, hey, here's the plan. you know what, this PPO plan with that now happens to be the best one, but you know what, we're not getting compensated. So here's how to go do that and get that. We can't be your agent. I'm sorry. We can't work for free, but here's how to go. Here's what to do. So that's going to be challenging, but it's also just very challenging, the nature of finding the plan, because you need to go and check to make sure your medications are covered. This is it for Medicare Advantage. Make sure your medications are covered. Make sure your doctor takes the plan. Make sure no changes are happening. University of Michigan has a plan currently that people can get into. It's an Advantage plan. It is leaving the market December 31st. So we had somebody ask us yesterday saying they wanted to enroll into that plan. So our job is to say, don't do that because it's going to be gone December 31st. Don't pick that plan. Let's try to find another one. So those are the things an agent can be very valuable for, because we live in this space. This is what we do all the time. But it's hard for the layperson, like you said, to really understand Medigap providers. You know, what is a good long-term pick? Because with a Medicare supplement, you can't just change whenever you want. So you have to go through a medical screening to be able to change. Not everybody can do that. So that's very challenging too. A lot of companies are not so great in terms of ones you would pick. So, you know, we have 10 we probably work with in Michigan that we know and trust. But in order to do that, you really just got to work with an agent. It's just a very challenging project. And we always hear too that I'm 65. Why do I have to deal with this stuff now? Why do I have to know all this stuff? Why? The old days of work insurance, and you probably remember back, Henry, yourself, is when you were on the insurance for the firm, it was easier because you just didn't have the choice. You really couldn't hurt yourself. You just picked package A or B and changed it if you needed to the next year. But Medicare is a lot more confusing at a time of people's lives that it just doesn't, we don't welcome the confusion. That's for sure.
Joanne, why wouldn't companies pay you? I mean, you'd think they'd want your business. They want to pay you because you're the one who are bringing the consumers such as myself to the various plans.
Yeah, absolutely. We are doing their work. So they would love for us to do their work. But really what happens is when a plan wants to control the enrollments, they will make a plan not commissionable. They just want to control enrollment. So we are seeing a trend this year, a pretty heavy push by all insurance companies that are offering Medicare Advantage plans to really reduce and isolate and limit the PPO offerings. The reason they're doing that is cost control for them, because when they can make an HMO tighter network, more restrictive, things like that for the consumer, the insurance company saves money, correct? So the fact that they're going to save money by doing that, the first thing they will do is saying, okay, agents, stop, no PPOs. We are not paying you for PPOs anymore. That allows them to naturally reduce the selection because the agents are just not going to be pushing those plans, if you will. So you're going to, and agents are all different. Some are going to show you all of them, and some are just going to show you the ones they're paid for. So that's just, we like the full disclosure. I think people should know what their options are, but it doesn't mean that we should do work for free, for sure. But it's trending towards that this year. And I don't know if that's going to be a short-term trend or, in 5 years, do they just want agents gone? Who knows? This is an interesting thing too. I can bring it up, but there was a bill proposed in Arizona. I don't think it's going to go very far, but this could tie into these types of conversations. The bill basically has that there will be an automatic enrollment for all people turning 65. They're basically thrown into an Advantage plan by the government's choosing. And you have to stay there for 3 years. And the only way you can get out of that plan is if you know that this is happening and you've got a window to get out. I think it would be totally insane and a total uproar, but who knows, right? So is this part of at that point, you don't need an agent, right? If you're just thrown into a plan and you have to go figure it out. So I don't know, different conversation.
What will the quality of care be in these plans?
No idea. No idea. We shall see. We'll let what the insurance company can pick what the quality of care will be. Very reassuring, right?
And you said more and more Medicare Advantage PPO plans are going away. Is this because of costs or what?
Yes, it's because of cost. Because again, with an HMO, there's more restrictive rules. They're typically maybe a lower out-of-pocket maximum, things like that. You don't have the ability to go out of network. All of those things are cost savings for the insurance company. So when you put rules in place and the consumer signs on, you're signing on to say, I'll abide by these rules. That's what you're getting for the reduced cost, reduced max out of pocket, potentially extra benefits, things like that. So we're just starting to see the plans come out. We get a first look, but we can't tell the public till October 1st. October 1st, you all can see everything, and you're going to want to pay attention to what the benefits are. So sometimes they will bulk up some of the additional benefits to entice people into those plans. So you just want to make sure you're paying attention to what you're getting for your body. Does your doctor take the plan? Is the medication covered? Try not to get all, into the bells and whistle of a plan as the freebies, because they might not be there the next year. Okay. You want to pay attention to what your body needs for medical care. So that's very hard to get people to pay attention to sometimes, because the TV commercials all light up and it's chaos, right? And it's very enticing, some of these plans.
Joanne, what is happening with insurance companies?
They're fine. At the end of the day, they're fine. There's some, of course, news, the United Healthcares of the world, the CEO being killed last year. A lot of people had a lot of issues in terms of, if they had a supplement with United Healthcare, there was a lot of panic. What happened on TV and what happened to this gentleman and what happened to the industry is nothing new. This has been going on for years and years and years. So the insurance companies have long made money from the federal government. The government pays the insurance companies to run Medicare Advantage plans. It's very simple. You pay the government your Part B. They take that money and they give a whole bunch more money to the insurance companies. Then insurance companies will manage a person's care as they enroll into these plans. It's not always good. It's not always bad. We have thousands of people with Medicare Advantage that are very happy with their plans, and we've got people that are not happy with their plans. So there can be bad outcomes. So when there's a bad outcome, that's what makes the news, things like that. The insurance companies, and this is uniform for all insurance companies, it's abusive in terms of there's a way that they can upcode, we call it, and they can get more money from the government to take care of people. So sometimes you're seeing that in the news, and then there's a lawsuit and then a payoff and all sorts of things. But I will say it's not isolated to one insurance company. It just isn't. It's old news. So every time it kind of pops into the headline, it's a nothing burger to us. But insurance companies do make a lot of money, right? The CEOs are making a lot of money, things like that. They don't want to pay agents, right? So all that kind of stuff gets into the public psyche, of course, and everybody's, right? We represent insurance companies. They can be good to us, they can be bad to us, but I don't know if they're a necessary evil, but they are in our system, right? We do not have universal health care. I don't see the day that happens either, but they're part of the middle, the layers of getting the consumers what they need. So it's challenging, but don't be scared of the headlines like the United Healthcare scares.
Joanne, will the new legislation impact with all the cuts? Is that going to impact on Medicare?
The real impact for us will be people that will lose Medicaid, that there's a segment of the population referred to as dually eligible, because they're dually eligible for two programs, one being Medicaid, one being Medicare. So when they have access to both programs, us in particular, we send that person to a specialist in Michigan that we work with. We don't work across state lines with Medicaid because it goes by state. It's just too much to know, even in Michigan. So our person in Michigan may lose clients because somebody loses Medicaid, right? So then that person, I don't remember the stats, but let's say 100,000 people in Michigan lose their Medicaid status. So then they just become a regular Medicare client to us. So then we can work with them. So we will be busier in that respect. In terms of physician cuts and pay cuts, that's been going on for years. There are some cuts built into the big, beautiful bill specifically to Medicare, but it's only if, certain cost parameters get hit down the road. There's kind of an emergency reaction that could happen. It's never been enacted, never happened. So we tend to try and not worry about things that haven't happened yet. So on the surface, really nothing has changed with Medicare cuts, and from the bill, nothing will change. But things will change with drug plans. But again, this is no different than past years. You have to pay attention because all those things kind of shift coverages. So you need to pay attention to see if you're covered in the new year. So a lot of our advice is really just same old, same old. Just treat this year like any other. However, know that all the costs are going up in terms of affecting the consumer. And I talk about this often too. Right now, there's 62 million people on Medicare. In 5 short years, that number is going to be 79 million. That is a huge, gracefully graying segment of the population. It's just huge. So we've had a lot more conversations with our clients over the last couple of years about things like protecting yourself, buying a cancer plan. That means if you have a cancer diagnosis, you get $10,000. That $10,000 is not meant to pay you because you got cancer. It's meant to pay your max out of pocket, pay for your chemo radiation if you need to, things like that. Short-term care. Lots of people cannot afford long-term care, or you cannot get it. So we have short-term care products that are fabulous, that can help people with custodial care and
Joanne,
care in an assisted living.
Well,
Yeah.
tell us about short-term care. I mean, long-term care, I actually have long-term care
Oh, do
insurance.
you? Okay.
Very hard to
Good.
get, and it's very
Yes.
expensive. You're right.
Yes. Yes. That's the key. So short-term care is different. So I turned 60. And when I was 58 or 59, I bought myself short-term care. I pay only $77 a week, a month, a month for my short-term care. What it means is if I need to tap into my care, I have up to 52 weeks of home care, and I get $1,200 cash every week that I am on claim for my home care. So that $1,200 comes to me cash, tax-free. I can take that money. I can pay a neighbor to do something for me. I can hire a service. I can go on vacation. I can pay for doctor visits. I can do anything I want with that money. So it's designed to be short-term in nature, which is under 360 days, which is why I can get 52 weeks. It's just, you have to, anytime over 360 days becomes long-term care, as you know. And Henry, you might have a 6-month elimination period, a waiting period, if you will, or 90 days or something like that. Short-term care kicks in immediately. We always do a 0. Just don't wait. Just when you need it, boom, you can just exercise your short-term care bucket. Covers people in a facility. It covers them in a long-term care, nursing home, any place they are, if they choose facility coverage in addition to the home care. So that's become definitely a bigger part of our practice these days because it's so unknown. Financial planners tell me consistently they don't know what short-term care is. And once we explain it, they're like, oh my gosh, I can think of a dozen people that need that. It just is, it's much cheaper, as you mentioned, to get than long-term care. And it's just way easier to qualify for. There's even one plan that my father, I was just sharing with Henry that my father was diagnosed with Parkinson's, and we bought him the plan that he can have, and he qualifies. And so it's very, very, very unusual. It's not as robust as the other versions of the short-term care, but it's still a short-term care plan, and it can still help. So I love that topic. It's one of those topics that I just think is so, I think our world, and I think, Henry, you would agree with me, is our world is woefully unprepared for the numbers of people coming through that 65 plus in the next 5 years. And I think as a society, we're really not prepared for any kind of care issues. We're just not. We get lots of those calls from the kids that are 60. My dad's 87 and he fell and he needs this, and who's going to pay for it? How come Medicare doesn't cover it? Medicare is not going to cover those things. Medicare will cover in-home medically necessary care. They will not cover custodial care. They will not cover a lot of things that people assume they're going to cover. And the cost is going to float to the family. That's always the next question. Like, well, who's going to pay? It's like, well, the family cumulatively is going to pay, whether it's time or money, the family's going to pay, right? Unless you're going to Medicaid, and we can all see what's happening with Medicaid. So not an easy area at all. I just think there's a tremendous need for more planning and discussion in the short-term care arena for sure.
You're so right, Joanne. And what's fascinating is the fact that, I know of people who are going through the system, and like you're in the hospital, then you're in a recovery nursing facility, then you have to go to a different type of facility. And it's almost like playing chess. And the other factor is, you have to plan years in advance. I mean, like in Michigan, there's a 60-month, 5-year look back period if you're trying to avoid having to shelter some assets. So it's very, very tricky. And Joanne, what you're saying about short-term care is excellent. And as far as long-term care, I know it's almost impossible to get now, and if you have any pre-existing conditions, forget about it. Joanne, what about the reality of versus slick TV ads and your actual coverage? I mean, TV is inundated with ads for medications and for everything for insurance. Tell us a little about that conundrum.
Yeah, when you think why those ads are there is because they work. People see those ads, they see something that lights up and, reduce this, you get free groceries, you get free transportation, you get free all this kind of stuff. They work. They work for the senior that's just at home and just dials or answers the phone. The only thing I can say to people, I'm begging you all to not answer the phone. Don't call those ads. They are very specifically targeted ads that are typically not your zip code and you will not qualify for. You've got somebody maybe in Grosse Pointe that is calling for a plan that's available in Louisiana that is for people that are dually eligible for Medicaid and Medicare, and that's not you in Grosse Pointe. So it's very deceptive. It's the call centers. There's these giant call centers that, they hire people that are tasked to just get enrollments, right? So when I started talking earlier, we focus a lot on, do you need Medicare? That seems like a silly question because everyone at 65 assumes they do need Medicare, but they don't. So we focus on that question a lot. Whereas you compare that to the robocalling call centers, they don't care. They're just, hey, your birthday's September 18th. I see you on the list here. You got to get signed up. Did you do it? And they panic you into signing on. So that's an enrollment. So they're off to the races with an enrollment. It's just a hard time. There are all sorts of rules, CMS regulations. We have to record phone calls. We have to tell you the call is recorded. We have to tell you how many plans are. It's crazy how many hoops we have to jump through, but then you can have call centers that just seemingly can just do whatever they want. So there's definitely bad actors. There's 100,000 agents dedicated to the Medicare space across the country. We know some fabulous agents. We know lots and lots of very good agents. So the average agent, I would say, is not the call center. But you want to avoid those types of things because they are not going to be found when you have a problem. If you need to call somebody or get something fixed, they're not going to be there. And you just want to, in my opinion, have a longer term relationship with your agency. I have stopped taking new clients, but my agents handle all the new people coming in. And we've got 10 people that handle everything that they all need. So we babysit our clients going forward. So if you can't find me, you can find Aubrey, you can find Trina or different, so you have to, I would say, just, be very, very wary of where you're buying your insurance from, because Medicare is not the type of insurance like your car insurance. It's not like you can just go up and change it all whenever you want during the year or on a whim. There's rules that go with Medicare. You might be stuck with your current agent or agency set up. So maybe that call center, you're stuck with them forever. If they close down, you're stuck. If they disappear, whatever, you're stuck. If you like that agent you signed up with, they're gone. They last for 6 months through the season and they're gone. So it's there's a lot of money in Medicare in terms of the insurance companies making a ton of money on Medicare Advantage. They're making a lot of money funded from the government, going into the Medicare Advantage system. It costs we, the taxpayer, costs us 4% more to run Medicare Advantage than original Medicare. So there's some downsides to original Medicare. I'm sorry, to Medicare Advantage. But it really always kind of comes down to follow the money, right, Henry? It's like we've seen that over our lives. It's just follow the money and somebody's doing okay.
Joanne, we're out of time. This has been an important topic, and of course, you've covered it admirably. So I want to thank you so much for being our guest on Gracefully Graying today. I want to thank our viewers for watching, and of course, I want to thank our sponsors and, of course, Bloomfield Cablevision. Thank you so much.